Dr. Cabaltica, do you just want to share what we're seeing in terms of COVID-19 cases and positivity here in our community?
Sure. Over the about a month ago, we've just seen a plateau of cases, not really seeing any more rise. But over the past week, we've seen a rise of about 50%, just about 115 new cases each day over the past 7 days. So that's a large increase. And so we keep trying to do the contact tracing as much as possible to try to keep up with all those cases, to try to track down the contacts so that we can try to mitigate any further spread. But that's a real challenge if folks aren't answering the phones. I know everyone's tired, but we really do need your cooperation, or at least for you to do the work to go and tell the folks if you've turned positive. Let your friends know who you've been around. The greatest increase though in cases, not surprisingly, is in the 0 to 11 age group, the age group that has only recently had any vaccine accessible to them. That was a 2.3% increase. So if you're a little bit hesitant, you have a school age kid, I would really recommend that you try to get that your kids from 5 to 11 vaccinated with the Pfizer vaccine. So positivity rate has never been as high as it is now. It's 25%, over 25%. So that's higher than what it was about a year ago when we went into the surge in October. So yeah, it's out there, and about a quarter of the cases, a quarter of the tests that are being done now are positive. That's what that rate means. So yeah, keep wearing your mask, keep washing your hands, try to avoid mass indoor gatherings if at all possible. Yeah, if you're going to be getting together with your family, one thing that's now available to us is maybe doing one of those at-home tests to make sure you don't expose your friends and family before you join any of those events.
Thank you. And the second headline that we want to address is our hospitals are full. Dr. Campbell, can you share more about what we're seeing at Lakeland?
Yeah, so not only is Spectrum Health Lakeland full, it's full across the state. We are busting at the seams. We have folks in hallways. We have opened up new clinical areas to put patients and waiting areas and beds because we're so full. Waits in the emergency department have never been longer, and there's no end in sight. We are now at about nearly 80 in the hospital. That's about where we were at our peak last November, a year ago. But a year ago, the positivity rate is half what it is now. So this is not over. It's still climbing, and we expect it to still climb. And of course, we haven't seen Omicron, and we'll talk more about that later. Fatigue is at an all-time high. There are staffing crises around the state and across Spectrum Health and Spectrum Health Lakeland. And so it's as busy as we've ever been at a normally busy time of year, and before influenza has really hit us hard. So we're concerned.
And as you mentioned, we do have a new variant that has emerged. What do we know about that so far?
So November 24th was when it was announced by WHO that there was a new variant in South Africa. It's also a place that had seen a wave of Delta. And when some of the PCRs that were done started dropping out, one of the signals that they look for, they realized there was a new kid on the block. And so it's been described, or rather identified, about a third of the states. Now, thankfully, here in not only Berrien, but the rest of Michigan, we haven't seen it yet, but it is coming. We have an international population here. We have universities that surround us here in the county. So yeah, it's on its way. The things that we can tell about it right now is that it seems to spread more easily. Okay, but it doesn't seem to be giving a severe disease at this stage. Now that's, you need to take that with a grain of salt, because the folks that it's infected so far have mainly been the younger population, university students there in South Africa. So we'll see we'll see how it plays out as far as vaccinations as well. There's some evidence that it may actually be able to evade some of the protection of the Pfizer vaccine, which is the one that's primarily used in South Africa. But it's not clear that it's not that the vaccine won't prevent severe disease. It looks like if you've gotten the booster, then that's going to help continue to protect you against severe disease and death. So if you're thinking about it, again, go ahead and get that booster at this point. Pretty much anyone 18 years old and older is cleared for that booster. The treatments, again, it's too early to tell whether or not the treatments are going to be able to be as effective. But yeah, so just stay tuned. Let's not panic yet, but do continue doing the things that we know how to do in order to try to prevent this spreading any further.
I would just add to that we know how Delta spread. We watched that spread across the world, and the early evidence in Omicron is it's spreading markedly faster. As the doctor said, the transmission rates are running higher, and we expect this to spread across the globe and give us a fifth surge. I mean, it's pretty clear that's coming. And I hope it's not going to be as fatal, clearly. But if it infects twice as many people, the number of folks that could have very serious side effects or die is still going to be pretty high when it comes to, a healthcare or hospital perspective. So we're anticipating that fifth surge and concerned that it not infect you, that we want you to be careful and we want you to be protected.
One of the positive headlines that we do have to share is that vaccines are saving lives. And while boosters are needed, we are seeing that vaccines are keeping people out of the hospital. Dr. Hamel, can you share more about that?
So I can tell you this, and this is data from across the country, and it's data across our 13 county service area at Spectrum Health. If you are unvaccinated, you are 6 times more likely to get sick. You're 10 times more likely to go to the hospital, and you're 10 times more likely to die. Now, that is just a fact that we have seen in review after review of the data and from our own data as well. Now, that's not age adjusted. If you're 50 and have diabetes and hypertension, your chance of going to the hospital or dying may not be 10 times, it may be 50 times greater or 40 times greater. But in the whole population, it is 10 times more likely to go to the hospital, 10 times more likely to die. The vaccines are working. There's no question about that. Is it perfect? No. Do the antibodies wane? Yes. Of course. Might boosters help prolong that? Of course. We know they're very good at prolonging that. But we know the vaccines are a much safer way to get an immune response than is the disease. And so we've been pleased that they work, and we've been pleased that boosters are available, and the boosters appear to be adding a lot of additional protection.
Thank you. And as you mentioned, boosters are available for everyone 18 and up, and then we are also vaccinating all those age 5 and older. So Dr. Cabaltica, can you share where someone can go to get a vaccine if they need it, or what the current process is like?
Well, the process is the same as before. Anyone who's 12 and older can get it at the doctor's offices, at pharmacies, and so over at the health department as well. We're still open for that. The health department is probably the best place if you're trying to get your 5 to 11-year-old vaccinated, simply because we were an early adopter, and we had the ability to just move faster than the rest of the healthcare system. But pretty much all of the pediatric clinics within that I'm aware of have already access to some of the vaccine, perhaps not as many as the health department. So just call your pediatrician. If they don't have any, then the health department has dedicated clinics, because it is a different vaccine with a different dosing. So we want to make sure we separate out that population so there are no mistakes, minimize any mistakes for the vaccinations. So.
And another headline that we wanted to address is the idea of long COVID looming. So Dr. Hamel, can you explain what long COVID is and what this means for some people who have been infected with COVID?
So long COVID in general is that you have symptoms related to the disease that are present a month after you got sick. Now, some folks will say 3 months after you get sick, but it is a kind of a delayed symptom after we think you should be better. There are about 200 symptoms that are reported with long COVID. We're seeing that the prevalence of this is somewhere between 15 and 85%, depending on who you read or how you define long COVID. But the point is, it is incredibly common. The most common prolonged side effect is fatigue, but there's others: shortness of breath, hair loss, body aches, temperature instability. About 200 symptoms have been reported. So far, we don't know if there's any specific way to cure that. We're working to understand it. The treatment is symptomatic, nor do we know how long that's going to last. But we have some reports from the literature where folks are having up to 30% are having symptoms a year later. So take this disease seriously. Just because we expect you to survive it does not mean you're going to get over this without long COVID. Long COVID is a very frequent experience from those who have recovered from the disease.
I'd also add that it seems that for those with long COVID, if you get vaccinated, then about a quarter of them to a third of them will actually improve. So that's just another reason that if you survive the COVID, go ahead and get the vaccine afterwards. In fact, just the combination seems to give the best immunity going forward.
That's a good thought.
Thank you. And along with the current COVID surge, we're also concerned that there'll be a surge of influenza, which in the community and will also stress our healthcare system. Can you both share more about this and what people should know about the flu season this year?
Well, as we know, flu season last year was pretty much non-existent because there were so many mitigation measures in place that I don't think it had a chance to spread. This year, not so much. We're back in person schools. We also have no mask mandates necessarily, although there's a strong advisory to go ahead and wear masks. And people are just tired. I'm tired of it as well. But we can't let our guard down at this point. Right now, as far as surveillance, there's the influenza-like illness that is more syndromic surveillance. It's about 1.6% right now, so we haven't hit the flu season. As far as prevention measures, the Michigan MDHHS has the aim of getting about 4 million doses of the flu vaccine out. And of that goal, maybe we're about 2/3 of the way there, about 2.5 million have been given. So kids specifically 5 years old or younger, and adults 65 years or older, or if you have any sort of underlying illness like asthma, COPD, heart disease, those are going to be the folks, regardless of your age, that you're going to be at higher risk for. So yeah, stay tuned. I hope that it's not going to be bad, but with less mitigation measures in place, I think we're probably going to see more flu this go around.
I'll make a quick comment too. We've had one of the biggest influenza outbreaks the University of Michigan and a university recorded over a fairly short period of time. If that trend continues other places, we're going to see a lot of influenza. It appears to be very contagious. I certainly can agree. We've let our guard down when it comes to protective measures. The data on masks, I understand you're tired. I understand we're all tired of masks. And you may have read a lot of reports of how effective are they anyway. Study after study says these work much better than no mask at all. The challenge is people are out there either transmitting COVID that they don't know they have, or maybe occasionally don't care they have. And wearing that mask, if you have any symptoms, all helps protect those around you, clearly. But wearing a mask helps protect you from those asymptomatic spreaders that we just know are out there. Your risk is lower depending on how well your mask fits, how long you've been exposed to somebody, and how far away you are. Your risk of getting COVID is somewhere between cut in half or cut up to 200-fold. The best fitting masks worn, consistently and deliberately, like N95s, are incredibly effective at preventing the disease. The looser masks, not as much, but they still can cut your risk in half or in quarter or in 1/10, depending on how consistent you are with the use. The other thing that's really important is hand hygiene. And everywhere I go, I find what we used to do at the beginning of this, everybody was carrying a hand sanitizer in their car, in their pocket, and just being deliberate about it. Folks have become a little used to this disease. Keeping your hands clean, incredibly important. You will prevent that inadvertent touch to your face and moving a virus from a surface someplace to your nose or mouth or eye. So please continue to wear those masks. That'll not only help with COVID, it will help with influenza. And please make sure your hands are sanitized very frequently.
Interesting you mentioned the University of Michigan outbreak. I actually talked with the medical director of the health department over them and asked, doesn't University of Michigan have a mask mandate in place for this in-person learning? And he said, yes, but you have to realize those students go off campus and they'll have social gatherings, and that's actually where influenza was. So even though you may have masks in your workplace, if you're not realizing that there are folks that may be carrying other diseases, and you think, oh, it's not COVID, oh, I just want to enjoy some time with friends and family, by all means do that, but realize, let's try to do the mitigation measures as much as we can, practically speaking. So, and by the one thing I failed to mention, if you finally do decide to get the flu vaccine and the COVID vaccine, you can get them at the same time. you can do that, and there's no effect one or the other. It's probably the best combination, the best cocktail to do this season.
Thank you. And MDHHS recently released some new guidance for schools. So what has changed, or what should parents and students know?
Yes, so there's been given a lot more time and to the reality that not everyone's going to want to do everything. Okay, so we do have vaccines in place, so we can relax some of these measures. I mean, at this point, some of the options that are now on the table with schools are that if a student has been vaccinated, they don't necessarily need to quarantine. That's huge. They do need to still mask. They do need to still monitor for symptoms, since it is still possible after getting the vaccine to get it and pass it on. It's probably less likely compared to the unvaccinated. So in the second case, if they're unvaccinated but masked, schools don't need to have a discussion with us to allow them to participate in school activities, as long as they, again, mask up and they do the symptom management, symptom screening, but that they also do a test to stay strategy. So even the unvaccinated can still stay in person by testing every other day for the first 7 days. So we're trying to make this as easy as possible for as many students as possible to remain in person, because we know that is the best way forward. That's got to be the way forward for the young ages as we try to balance the risk of them getting COVID and passing it on to the more vulnerable folks, which they're not likely going to be as high risk for hospitalization, but it's the secondary transmission for them. Finally, for the unvaccinated, unmasked, schools in consultation with us can still decide to let those students participate, but it has to be on a case-by-case basis, because some exposures are not going to be as high risk, and we want to be able to allow as many students to get back to school and to remain in school if the risk is low. So, for example, if it was just a close contact in the hallway for but a few seconds, well, that's not really as high risk, and we may be able to work something so that those students can rejoin and do in-person learning while they're going through that period of possible incubation. So the bottom line is just be honest with your exposures, work with the schools, and even if you're unvaccinated, there still may be a way for us to help schools keep students in person. So we're trying to balance the things that we can do for prevention versus containment. So hopefully that's the balance is going more towards in-person with lower risk as we go forward.
Thank you. And we're preparing to head into another holiday season with Christmas and New Year's on the horizon. What guidance would you share for folks to stay safe during those events?
Yeah, that is a really important question. We know you want to be with your loved ones, and we know you will be with your loved ones. But we've said this a lot. You know how to be safe. Keep your hands clean. Keep your masks on. Remain separated physically as much as you can. Make sure that if folks are having symptoms, that you make sure they're isolated until they're tested and confirmed negative. It's just really important not to spread this through our community. Recall this: it's been about 1.75 years since we started this war against pandemic, and we have lost more Americans than every war we have fought in this country, from the Civil War to World War I to World War II to Vietnam, in just 2 years. In Berrien County, we have lost 352 souls from COVID-19. We've passed 10,000 admissions across Spectrum Health of folks sick with COVID. This is a real disease and is shortening the lives of so many within our community. And we need to work together. We need to be arm in arm as we're fighting the ravages of this disease. It is not over yet. Now, I hope the most recent strain is less lethal. I hope it provides long-lasting immunity. I hope this will be one step closer to getting through this pandemic, but we don't know that yet. And at this point, we are as full as we possibly can be across all of Michigan's hospitals, and we have a 5th surge coming. So we just implore you, take good care of yourselves, take good care of those you love. Spend one more Christmas being just as careful as you possibly can. The only path through this is to be, so careful of protecting the health and well-being of you and those you love. So please do that.
But add that this season, again, we have a lot more tools in our toolkits to be able to mitigate against this, not only prevention but also treatment. So there is hope at the end of the tunnel. Again, if you're going to be getting together with the older generation, even if they're vaccinated, they are still prone to a higher mortality if they get reinfected. So do get vaccinated if you're going to be getting together with your older relatives. In addition, there's over-the-counter test kits that you can get. So I know it's hard to try to get tests done before gatherings, but you can actually test yourself. If you're having any symptoms, just go ahead and buy a test, get the test done, and try to prevent and head off any further spread within your families. I guess the one thing that I've noticed sitting in this seat, getting so many emails and calls and sitting in the public comments after our Board of Health meetings, is that there's a lot of information out there. And unfortunately, the misinformation, the bad information tends to spread 6 times faster on social media than true information does, because it grabs your heart. It hits you emotionally. It usually comes from someone that you trust. And so I just implore you that before you pass any information on, make sure, is it true? Who's the source? Why are they sharing it with you? And if you're wondering, this doesn't seem to jive with anything else I've listened to, try to fact check. I know for myself, I get my news from the opposite ends of the pole, from Wall Street Journal as well as the New York Times. And I usually try to extrapolate. The truth is going to be somewhere in between those two. One side or the other does not have the whole picture. So try to get your news from a wide variety of sources. And it's risen to the level that even the Surgeon General now has taken the initiative that we need to try to clean up our information ecosystem, because it's really poisoned the waters and made it very difficult to make good decisions. So if you hear something that seems really, really ominous, ask the person, how do you know that? How do you know that that's true? And then do your own research, because I think we're all responsible for ourselves. We're responsible to love our neighbor, love our families. Make sure that the information that you're sharing is as true as what we know at the present time. Realize, scientists don't have all of the truth right now. They're working hard, but we extrapolate to the truth as we gather more studies. There isn't one study that has the truth. It's going to be the handful of studies that are done by really good researchers that will finally give us the best picture overall.
Mm-hmm.
Thank you. And as a reminder, you can always find trusted information about COVID-19 on both of our websites, spectrumhealthlakeland.org/COVID-19 and bchdmi.org/COVID-19. So we thank you all for joining us, taking the time today to hear this information, and we wish you a safe and healthy holiday season. Thank you.